Your nose will be photographed in 8 different angles, and the possible after-surgery look of your nose will be displayed to you in 3D simulation. With closed rhinoplasty technique, nasal humps can be removed, nose tip can be lifted, curvature of nose bridge can be straightened, asymmetry in the nostrils can be fixed. Right along with those, if you have contour or deviation problems, they can be treated in the same session. Closed rhinoplasty technique won't leave any visible scars on the tip of the nose. Structure of nose contains nasal bone, upper alar cartilage, lower alar cartilage, and in the middle line, nasal septum. Under general anesthesia with intranasal chisels, upper and lower alar cartilages will be relocated in the middle part. Nasal hump will be removed without hammer by using special equipment. Following this process, nasal bridge will be rasped. After the hump is removed from the nasal bridge, right and left side of the septum will be cut vertically, and then double-sided horizontal cuts will be done at the top of the nasal bone. For achieving an aesthetic side view of the nose, upper side of the lower alar wings will be removed. After this step, cartilage grafts taken from the septum will be relocated either side of the upper septum. The vertical cartilage grafts, which will be placed in the nose tip and lower alar cartilages, are shaped with stitches. Thus, looseness of nose tip and asymmetries of the nostrils are fixed. Cuts on the nose tip will be closed by the anatomically dissolvable stitches, therefore there will be no need for removing stitches. For the final touch of the aesthetic form, lower sides of the nasal bone will be cut downwards. Later, the gap in the nasal bridge will be closed by pushing both sides. For supporting the internal structure on the middle line, silicone leaflets will be placed in both nostrils. After the skin-colored special nasal strips are applied, operation will be finalized with placing thermoplastic splint on the nasal bridge. Now, if you wish, we'll show you before and after images. Nasal hump is removed. Nose tip looseness is fixed. Curvature of the nasal bridge is centralized. Asymmetry of nostrils is fixed.